Today, we'll be delving deep into 13 surprising and common skin indicators of diabetes. Did you know that a staggering 25% of people with diabetes discover their condition because of skin-related problems? That equates to a quarter of all cases brought to light through the narratives our skin provides. As our body's protective shield, the skin often reveals the first warning signs of underlying health challenges. Those subtle skin changes you've been dismissing could very well be your body alerting you to fluctuating blood sugar levels. Indeed, every rash or seemingly insignificant skin tag might be hinting at a chapter in the intricate tale of your overall health. Before we dive in, could you take a moment to hit that like button? Also, ensure you're subscribed to Diabetes Fixer for valuable insights on diabetes. Don't forget to click the notification bell so you never miss an update from us. And here's a little teaser. Stay with us until the end and discover how to claim 2 exclusive free gifts. Have you ever wondered why certain wounds on your body take an unusually long time to heal, even with meticulous care? And those dark, velvety patches appearing in your body folds, could they be hinting at more than just skin discoloration? Dive into this video with us as we unravel the mysteries behind these symptoms and shed light on what they truly signify about your health. Don't miss out. Your skin might be telling a story you need to hear. At number 13, Eruptive Xanthomatosis. This relatively rare skin condition is linked to individuals with poorly controlled diabetes. Distinctive by its raised bumps, these lesions usually emerge in areas like the buttocks, upper thighs, insides of the elbows, and behind the knees. They might also appear on the arms, legs, and shoulders. These bumps often have a reddish periphery with a central yellow hue and can be itchy. According to a study published in the Journal of Clinical and Aesthetic Dermatology, eruptive xanthomatosis is closely associated with hypertriglyceridemia, which can be exacerbated by uncontrolled diabetes. While these lesions themselves are not harmful, their occurrence can be a sign that your diabetes management needs attention. Seeking advice from a healthcare professional can guide towards topical treatments to manage symptoms and underline the importance of diligent diabetes care. Spotting number 12. Dry and itchy skin. Persistent skin dryness and recurrent itching might be indicative of more than just dermatological concerns. Elevated glycemic levels have a propensity to extract crucial fluids from the body, culminating in skin desiccation. Moreover, excess cellular glucose can potentially inhibit the body's sebaceous functions, precipitating the emergence of flaky, pruritic skin regions. If you've been confronted with these dermatological symptoms and hypothesize a correlation to diabetes, it's imperative to engage with a healthcare specialist. They'll undertake a comprehensive glucose evaluation to determine any potential diabetic interplay. For individuals already diagnosed with diabetes or on the cusp of prediabetes, consider the following skincare regimen. Number 1. Ensure rigorous glycemic regulation to maintain optimal bodily fluid balance. Number 2. Favor tepid showers or baths. Excessive thermal exposure can compromise epidermal lipid layers. Number 3. Post-ablution. It's advisable to apply a moisturizing agent promptly, aiding in hydration retention. Number 4. Regular hydration is paramount. Consume adequate water to offset potential fluid deficits associated with hyperglycemia. And number 5. Periodically conduct a diligent skin examination for early signs of complications, such as erythema or edema. Let's proceed to number 11. Necrobiosis lipoidica. Necrobiosis lipoidica is a skin issue linked to both types of diabetes. It happens when there's a change in our skin's collagen, causing the blood vessel walls to become thicker. Sometimes, this might be the first hint that someone has diabetes. So, if you see signs of it and haven't been tested for diabetes, it's a good idea to do so. It's also worth noting that those with celiac disease might have a higher chance of getting this condition. At first, necrobiosis lipoidica might show up as small skin bumps. The skin can turn shades of yellow or brown, and it might feel different, becoming thicker or even gaining a shiny appearance. You might also spot tiny, colorful blood vessels beneath the skin surface. This skin issue tends to come and go in stages. When it's active, the affected skin area might become sore or irritated. While it's not typically severe, there are times when complications can arise. For example, there's a chance of infection, although it's rare. If you see any unusual changes in your skin's look or feel, it's crucial to consult your doctor. They can help identify if it's Necrobiosis lipoidica and advise on ways to manage and treat the symptoms. Number 10. Skin tags. Skin tags, medically known as acrocordons, are small, benign growths that can appear on different parts of the body. According to a study published in the Indian Journal of Dermatology, there is a significant association between skin tags and diabetes mellitus. These formations can resemble pale moles or darkened dots, either raised or flat. Individuals with diabetes tend to have a higher incidence of skin tags, possibly due to elevated blood sugar levels or increased insulin. While skin tags themselves aren't harmful, it's crucial to monitor them. Should you notice a surge in their appearance, it's recommended to see a doctor, as they might indicate shifts in your health or other underlying conditions. At number 9. Digital sclerosis. Digital sclerosis manifests as thickened, taut, and fissured skin, prominently on the hands and feet. This condition can lead to joint stiffness, hindering activities like writing or simple hand movements. As it progresses, this thickened skin can extend up the arms, legs, and even the back. In severe cases, joint flexibility, especially in areas like the elbows, becomes noticeably limited. This condition not only affects physical well-being but can also diminish one's overall quality of life. Though the root cause remains uncertain, individuals with a long history of diabetes seem more susceptible. If you notice signs such as skin tightness or joint rigidity, it's crucial to seek medical advice promptly. A combination of physical examinations and blood tests can help diagnose this condition. Depending on its intensity, your doctor might suggest topical treatments, physical therapy, or both to alleviate symptoms. Taking the number 8 spot, skin infections. Individuals with diabetes frequently encounter a heightened risk of skin infections. Elevated glucose levels in the blood can diminish the skin's natural barriers, making it prone to dryness and subsequent cracks. A study from the American Diabetes Association highlighted that high blood sugar levels compromise the skin's natural defenses, increasing its vulnerability to bacterial and fungal invaders. As the skin's defense diminishes, it becomes a gateway for these microorganisms, manifesting as infections. Common signs include redness, swelling, small raised bumps, flaky patches, and sometimes even fluid-filled blisters. Particularly susceptible areas are the spaces between toes, around toenails, and the scalp. Given the potential complications and the underlying connection to diabetes management, it's crucial to seek medical attention for persistent skin changes. The timely intervention not only addresses the skin concern, but also underscores the importance of optimal diabetes care. Number 7. Diabetic dermopathy. Diabetic dermopathy, often referred to as shin spots, is one of the most common cutaneous manifestations of diabetes mellitus. A study in the Journal of the American Academy of Dermatology reported that nearly 55% of patients with diabetes exhibit signs of diabetic dermopathy at some point. Characterized by light brown, scaly patches, these marks predominantly appear on the legs and feet, but can also be found on the thighs, torso, and arms. Although these patches are usually painless, their presence might suggest suboptimal diabetes management. Regularly monitoring these patches for changes is essential. While the patches themselves are benign, managing them with treatments like moisturizing creams or corticosteroid injections can help reduce potential inflammation and prevent them from worsening. At number 6. Xanthelasma. Xanthelasma refers to yellowish, soft, flat, lipid-laden plaques that are often symmetrically situated on the upper and lower eyelids, near the inner canthi. Their texture can be soft, semi-firm, or calcified. These plaques are essentially accumulations of cholesterol underneath the skin. A study published in the Journal of Diabetes and Metabolic Disorders has established a significant association between the presence of Xanthelasma and diabetes mellitus, suggesting that they can be a cutaneous marker of underlying insulin resistance or elevated blood sugar levels. Therefore, if you observe these yellowish plaques on your eyelids, It's not just a cosmetic concern, but a possible sign of diabetes, and it would be prudent to consult with a healthcare professional familiar with diabetes care for further evaluation and guidance. Spotting the number 5. Nail changes. Diabetes can usher in notable changes to one's nails, presenting symptoms like nail thickening, discoloration, and heightened susceptibility to fungal infections. The elevated glucose levels in diabetics can compromise the immune system, making it challenging to ward off these fungal nail invasions. Onychomycosis is one such concern. Moreover, diabetes might lead to unusually dense nails, possibly resulting from diminished nail blood circulation or even neuropathy, which impacts the surrounding nail muscles and tissues. Distinctive nail color shifts from subtle yellow hues to deeper browns or even stark black can also be observed. Such nail transformations could be indicative of underlying diabetes, making it crucial to consult a healthcare expert for a comprehensive assessment and subsequent guidance. Number 4. Dark velvety skin patches or acanthosis nigricans. One of the hallmark skin manifestations in individuals with insulin resistance, often seen in diabetes or in those who are overweight, is acanthosis nigricans. This condition is characterized by dark, velvety patches on the skin. According to a study published in the American Academy of Dermatology, these patches form due to an increase in insulin that stimulates skin cells to reproduce at an accelerated rate. Commonly, these patches appear in areas of skin fold, such as the armpits, the back of the neck, groin, and elbows, but they can also manifest elsewhere. Not just an external skin concern, their presence often signals an excess of insulin in the bloodstream, serving as a potential red flag for conditions like prediabetes or type 2 diabetes. If one notices such distinctive skin changes, it's imperative to seek medical consultation. Healthcare providers can conduct necessary tests to evaluate blood sugar levels and determine the appropriate course of action for diabetes management. It's essential to note that individuals who are overweight or have a family history of acanthosis nigricans are at a heightened risk, emphasizing the importance of regular skin checkups for early detection and intervention. Next on our list at number 3, blistering or diabetic bully. For some with diabetes, a peculiar condition called diabetic bully might emerge, manifesting as sizable, fluid-filled blisters predominantly on the legs and feet. These blisters are more prevalent among those who've been grappling with diabetes for an extended period. The genesis of these blisters is believed to be intertwined with neuropathy or nerve damage and compromised circulation in the impacted regions. Yet, it's vital to discern that not every blister in diabetic individuals is attributable to diabetic bully. Blisters can also surface due to external factors like physical friction or minor injuries, and their frequency might be accentuated in diabetics due to diminished sensation. A strategic approach involving vigilant blood sugar management and routine foot assessments can be pivotal in averting or addressing diabetic bully and associated skin concerns stemming from diabetes. At number 2, diabetic rashes. Diabetes, with its intricate web of symptoms, can sometimes manifest on the skin as puzzling rashes. These rashes, though diverse in appearance, often act as silent heralds of fluctuating blood sugar levels. They might surface as reddened, inflamed patches or even intricate patterns that itch or burn. While these skin eruptions can be disconcerting, they serve as crucial markers, signaling the body's distressed response to glucose imbalances. Recognizing and addressing these rashes promptly is paramount, not merely for the skin's health, but as an indicator to delve into one's blood sugar management. If such rashes make an appearance, it's advisable to consult a medical professional. Their guidance can shed light on the underlying cause and, if necessary, steer the individual towards a refined diabetes management regimen. Claiming the top position at number 1, slow healing wounds. The most concerning manifestation of diabetes is the prolonged healing time of wounds. A study published in the Journal of Clinical and Translational Endocrinology highlighted that high blood sugar levels can lead to the deterioration of blood vessels, thereby restricting optimal blood flow to wounded areas. Such restricted flow results in reduced supply of essential nutrients and oxygen, crucial components for wound repair. The challenge is further intensified by diabetic neuropathy, a type of nerve damage prevalent in many diabetes patients. This condition diminishes tactile sensations, leading individuals to overlook or underestimate minor injuries, allowing them to progress into more severe wounds. Additionally, the immune system's efficiency is compromised due to diabetes, slowing down the body's natural response to fend off infections. Elevated blood sugar levels can also become a fertile ground for bacterial growth, amplifying the risk of wound infections. Furthermore, many diabetics grapple with vascular conditions like peripheral arterial disease, which affects nearly 1/3 of diabetics over 50 as per the American Diabetes Association, and venous insufficiency. Both conditions impede blood flow, further hindering the wound healing trajectory. To navigate these challenges, it's crucial for individuals to work closely with healthcare professionals, emphasizing strict blood sugar management and thorough wound care. Proactive monitoring, early detection, and immediate intervention can make all the difference. Encountering slow-healing wounds or any unusual skin modifications signals the need for immediate attention to blood sugar control and overall diabetes management. Together, we've delved into the intricate ways diabetes can present itself on our skin, highlighting the need for keen observation and proactive steps. As we wrap up this enlightening discussion, we're genuinely interested in your personal experiences. How do you navigate and manage the challenges of diabetes? Your insights might be the beacon someone needs, so please share them in the comments. Stay connected with us by subscribing and activating notifications to ensure you don't miss out on vital content. A token of our appreciation awaits you. Find your 2 free amazing gifts in the description below. At Diabetes Fixer, our mission is clear: to equip you with research-driven knowledge, ensuring you're well-armed in your fight against diabetes. We value your time and trust. Until next time, prioritize your health and well-being.